Well, hello and welcome back to class. This is Applied Anatomy and Physiology, AAP 301 for the College of Natural Health Sciences, Bermuda. My name is Dr. Delcina Bean Burrows, and this is lecture number 15, where we will be discussing the urinary system. In our lecture today, we will take a look at the learning objectives for this lesson, the key terms, components of the urinary system, the role of the urinary system in fluid management, urine formation and composition, as well as aging and the urinary system. And before we get started, just to put your mind in gear, how much fluid do you think an adult bladder can hold? Also, do you think holding your bladder instead of voiding it frequently can lead to health issues? Now, in terms of our learning objectives, upon completion of this chapter, you will be able to explain the function of the urinary system and discuss its relationship and importance to manual therapy practices, name, locate, and explain the general functions of the urinary system organs, name the key structural components of the kidneys and describe their general functions, describe the role of the urinary system in fluid management, name the key structural components of a nephron and describe the processes that occur in each part, list and explain the 3 processes involved in urine formation, and discuss urinary system changes that commonly occur as the body ages. The key terms will be filtration, micturition, reabsorption, renal, renal corpuscle, renal tubule, secretion, urination, and urine. As the primary organs of the urinary system, the kidneys continually cleanse and refresh about 40 gallons of blood per day, ridding it of toxins and metabolic waste. In a process similar to panning for gold, the kidneys filter the blood to collect and conserve valuable nuggets of essential nutrients and ions, while unwanted substances are passed on for elimination. At the same time, the kidneys make adjustments to maintain blood volume and pressure and to keep pH and electrolyte levels within normal homeostatic ranges. The urinary system has 4 major components: the kidneys, the ureters, the bladder, and the urethra. The 2 kidneys are the primary organs responsible for the majority of system functions. The ureters, bladder, and urethra form the urinary tract. The ureters carry urine from each kidney to the bladder, which serves as a temporary storage site before urine is excreted through the urethra. The kidneys, or renal organs, are responsible for filtering blood and forming urine, or liquid waste. Each kidney is a bean-shaped organ about the size of a fist, situated parallel to the spine and posterior to the peritoneum lining of the abdominal pelvic cavity. The right kidney sits slightly lower than the left to accommodate the liver. The superior portion of each kidney is under the 12th rib, and the inferior edges are at the level of the 3rd lumbar vertebra. The kidneys are anchored to the parietal peritoneum and protected by a 3-layered envelope of fascia and other connective tissue called the renal capsule. Along the medial border of each kidney, there is an indentation called the hilum, where the ureters, blood vessels, and nerves enter and exit the organ. The kidneys are also a common source of nonspecific low back pain. To distinguish the referred pain of kidney dysfunction from the structural low back pain, therapists should be alert to associated signs such as sweating or fever and the client's description of the onset of pain. Internally, the kidneys have two distinctive sections of tissue, a relatively thin outer ring, the renal cortex, and a thicker inner renal medulla. Nephrons, the microscopic functional units of the kidneys, lie predominantly within the cortex. It is estimated that each kidney contains around 1 million nephrons. The renal medulla contains renal pyramids, triangular bundles of microscopic tubes that collect urine from a specific group of nephrons. At the inferior apex of each pyramid, a cup or calyx collects urine and transfers it through the renal pelvis into the ureters. And here we see illustrated the kidneys. In illustration A, the kidneys are situated parallel to the lumbar spine. The superior third of each kidney is under the floating ribs. In illustration B, each kidney has an outer region, the cortex, and an inner region, which is the medulla. The medulla is organized into renal pyramids that drain urine into a calyx. The calyxes press the urine into the renal pelvis, which drains into a ureter. The ureters are the muscular tubes that carry urine from the kidneys to the bladder. They are lined with a mucous membrane and they use peristalsis to move urine. Now let's discuss manual therapy applications with respect to the kidney and ureters. Since the superior 1/3 of the kidneys is situated just anterior to the floating ribs, manual therapists need to be cautious with the amount and direct pressure applied over the lower rib cage when working on the back. If deep or even moderate pressure is forcefully or abruptly applied in a lateral to medial direction, it could push a rib into the kidney and cause damage. To reduce this risk, it is important for deep or heavy percussive strokes, such as tapotement, to be focused over the erector spinae muscles or sacrum. The kidneys are also a common source of nonspecific low back pain. To distinguish the referred pain of kidney dysfunction from structural low back pain, therapists should be alert to associated signs such as sweating or fever and the client's description of the onset of pain. Kidney stones lodged in or passing through the ureters can create severe abdominal pain as well as back pain. In fact, kidney stones are very common causes of sudden onset left side abdominal pain. The urinary bladder functions as the temporary holding site for urine before it is excreted. The superior aspect of the bladder is attached to the peritoneum. In males, the bladder is simply described as an anterior to the rectum. In females, it is positioned just inferior to the uterus and anterior to the vagina. The bladder is similar in structure to the stomach, with multiple rugae in its mucous membrane. This allows the bladder to distend as it fills to hold approximately 25 fluid ounces, or slightly more than 3 cups of urine in males. Because the posterior aspect of the bladder in females is attached to the uterus, the average bladder capacity for them is approximately 17 fluid ounces, or about 2 cups, and even less during pregnancy. The bladder also has a 3-layered arrangement of smooth muscle in its wall, which facilitates elimination. The narrow tube that passes urine from the bladder to the external environment is the urethra. The process of eliminating urine is called urination. Similar to defecation, urination is regulated by 2 muscular sphincters. the internal urethral sphincter, an involuntary smooth muscle ring under the control of the autonomic nervous system, is situated at the junction between the bladder and urethra. At the distal opening of the urethra, a circular arrangement of voluntary skeletal muscles forms the external urethral sphincter. As the bladder fills, stretch receptors signal a micturition reflex, which causes relaxation of the internal sphincter. The stretch receptors also send this information to the cerebral cortex, creating the urge to urinate. Simultaneously, the brain sends a motor signal to the external sphincter of the urethra to contract. This inhibits urination until an appropriate time when, through conscious control, the external sphincter is relaxed and urine is excreted. This ability to voluntarily control micturition and defecation is a learned behavior developed during early childhood through the process of potty training. Time now for our first What Do You Think segment. And remember, the What Do You Think segments are designed to develop your clinical reasoning skills. What structural similarities and differences do you notice between the urinary, respiratory, and digestive systems? Let's now discuss the role of the urinary system in fluid management. You may recall from previous lectures that water is a major component in all body tissues and is critical for optimal functioning and health. Blood, lymph, cerebrospinal fluid, and interstitial fluid make up the extracellular fluids that transport dissolved nutrients, waste, and ligands. These fluids also distribute heat throughout the body and, together with intracellular fluid, serve as the primary environment for all chemical reactions. Fluid is continuously lost through evaporation from the skin, through breathing, and through elimination of urine and feces. Most water is replaced by ingested fluids and foods, even though some is generated in the tissues during ATP production by way of aerobic catabolism. Balancing fluid intake and output is a function of the thirst center within the hypothalamus. When water output exceeds intake, dehydration begins, saliva production decreases, leading to dry mouth, and the thirst center is stimulated. This stimulation creates a sensation of thirst, which signals a person to drink water or other beverages. While the signal to increase fluid intake is important in keeping tissues well hydrated, the homeostatic mechanisms that regulate output are far more important to maintaining fluid level balance and composition throughout the body. The kidneys play a role in these fluid management processes. Specifically, the kidneys have the following functions. They regulate blood volume. They also regulate blood pressure. They manage blood electrolytes. They maintain blood pH. And they produce hormones. Time now for our second What Do You Think segment. How does stress stimulate the RAA pathway? How does increased urine output help to lower blood pressure? Now let's discuss urine formation and composition. The kidneys cleanse the blood of metabolic waste products through urine formation, and in this process, the nephrons exchange fluids and dissolved substances between the blood and their own small tubules to either retain or eliminate water and specific ions and molecules from the body. Urine formation involves three distinct steps that occur in different portions of the nephron. Filtration occurs in the renal corpuscle, which is the bulbous initial portion of the nephron. The twisted hollow renal tubule that extends from the corpuscle is the site of reabsorption and secretion, the other two steps in urine formation. All three processes occur through the passive or active transport mechanisms. And here we see illustrated the nephron. Each nephron consists of a renal corpuscle, which includes the glomerulus and the Bowman's capsule and a renal tubule. In illustration B, an afferent arteriole carries blood into the glomerulus and exits the capsule by way of a smaller afferent arteriole. This arrangement increases the pressure inside the capsule for filtration. The tubule is surrounded by a network of peritubular capillaries so that fluid and dissolved substances can be exchanged between the blood and tubular filtrate. As the first step in urine formation, filtration occurs in the renal corpuscle of the nephron. The bulbous renal corpuscle is made up of a tangled network of capillaries called the glomerulus, which is surrounded by a cup called the glomerula or Bowman's capsule. Blood enters the glomerulus through a afferent arteriole and leaves through a smaller afferent arteriole. This narrowing of the outgoing vessel combined with the knotted arrangement of the capillaries significantly slows blood flow and increases pressure within the glomerulus. Just as an espresso machine forces pressurized water through tiny holes to make a cappuccino, fluid is forced through the capillary walls into the waiting glomerular capsule by way of filtration. This passive transport mechanism forms a glomerular filtrate of water and dissolved substances including electrolytes, glucose, amino acid, hydrogen, and bicarbonate ions and metabolic waste products such as urea, ammonia, and uric acid, and bilirubin. Changes in blood volume, arterial blood pressure, and blood composition all affect the rate of filtration in the renal corpuscle. Glomerular filtrate leaves the renal corpuscle through Bowman's capsule and enters the renal tubule, a passageway made of a single layer of epithelium. The tubule is divided into three regions, each named for its general shape and location. The initial coiled portion that attaches the glomerular capsule is the proximal convoluted tubule. It connects to a prominent hairpin bend, the loop of Henle, which in turn attaches to another coiled portion called the distal convoluted tubule. As the afferent arteriole exits the glomerulus, it divides to form the network of peritubular capillaries that surround all three sections of the renal tubule. The thin walls in both the capillaries and tubule allow for easy exchange between blood in the capillaries and filtrate inside the renal tubule. The majority of reabsorption occurs at the proximal convoluted tubules, including all of the glucose and amino acids that are initially filtered, about 2/3 of the water, and varying quantities of electrolytes. At this point, fluid that remains inside the renal tubule is referred to as tubular fluid. The third process of urine formation is secretion, which is movement of substances from the blood in the peritubular capillaries back into the renal tubule. Secretion helps the blood eliminate metabolic waste such as ammonia and urea, access hydrogen and potassium ions, and many medications. Both reabsorption and secretion occur along the entire length of the renal tubule. This continuous exchange between the blood and tubular fluid is necessary for balancing volumes, fluid volumes, pH, and electrolyte levels within normal homeostatic ranges. Tubular fluid left within the distal convoluted tubules drains into the collecting ducts. Several nephrons converge into one collecting duct where reabsorption and secretion continue. Water reabsorption in the collecting ducts concentrates tubular fluid into urine, which passes into the renal pelvis of the kidney, where it drains into the ureter. And here we see illustrated urine formation. Urine formation involves three processes: filtration, reabsorption, and secretion. Each process occurs in a different portion of the nephron. Now let's take a look at the composition of urine. Since the kidneys are responsible for cleansing waste and metabolic byproducts from blood, analysis of urine composition provides as much information about general health as it does about kidney function. In healthy individuals, urine is a straw-colored or transparent yellow fluid that is mostly water, plus pigments and variable levels of nitrogenous waste and electrolytes. The pigments that color urine come from the breakdown of bile and hemoglobin. Urine normally contains high levels of nitrogenous waste such as urea and ammonia from amino acid catabolism, uric acid from the breakdown of nucleic acids, and creatinine, the byproduct formed when creatine phosphate is used by muscle fibers for energy. Smaller levels of sodium, potassium, chloride, sulfates, and phosphates are excreted in urine to maintain homeostatic ranges of these important electrolytes. The average pH of urine is slightly acidic at 6.0, but its normal range is between 4.5 and 8.0. Changes in pH or in the types and concentrations of discarded substances are often related to diet. For example, high-protein diets tend to have urine more acidic, while vegetarian diet increases alkalinity. Eating beets gives urine a reddish tinge, and asparagus can give it a distinct odor. Changes in the composition of urine can also be a sign of disease, so urinalysis is used to diagnose various pathologies. For example, the presence of white blood cells in urine can indicate infection. Since urine should never contain glucose or proteins, their presence can indicate several conditions such as diabetes, malnutrition, or nephritis. Urinalysis can also be used to test for the presence of drugs or hormones. Home pregnancy tests check urine for the hormone human chorionic gonadotropin, or HCG, which is produced during pregnancy. And here we see illustrated in this table a summary of urine formation. The processes, the nephron location, the direction of the fluid and particle movement, and the description of purpose are all categorized according to filtration, reabsorption, and secretion. With filtration, the location is in the renal corpuscle, the direction is from the blood to the renal tubule, and in terms of the description and purpose, fluid is forced out of the blood by way of the capillary pressure through the walls of the glomerulus and into the glomerula or Bowman's capsule to begin the process of urine formation. With reabsorption, the location within the nephron is along the entire course of the renal tubule and in the collecting ducts. The direction is from the renal tubule to the blood, and in terms of its description and purpose, fluid and substances move from the renal tubule back into the blood of the paratubular capillaries, and this conserves water and vital substances, including glucose, amino acids, and various electrolytes and buffers. And in terms of the process of secretion, it occurs, the location is at the entire course of the renal tubule and in the collecting ducts. The direction is from the blood to the renal tubule, and its description and purpose, the fluid and substances move from the blood into the renal tubule to be excreted with the urine. These include hydrogen, potassium, ammonia, urea, and many medications. Time now for our third and final What Do You Think segment for this lecture. What changes in blood composition and blood pressure would increase filtration in the nephrons? Why do you think so much reabsorption occurs in the proximal convoluted tubule? Let's now discuss aging and the urinary system. Several structural and physiologic changes associated with aging result in diminished urinary function, especially when accompanied by decreased circulation related to cardiovascular disease or diabetes. For example, the number of nephrons decreases with age, resulting in slower rate of filtration and reduced ability to cleanse the blood. The kidneys' production of renin and sensitivity to ADH also decrease, which hinders their efficiency in regulating fluid volume and blood pressure. Many older adults experience a general reduction in thirst and subsequently reduce their water intake. All these combined factors predispose the elderly to dehydration. Additional renal changes include a decline in the production of hormones erythropoietin and calcitriol, which contributes to anemia and poor calcium reabsorption from the small intestine. Now let's take a look at the manual therapy applications with respect to aging and the urinary system. A general decline in kidney function as well as increased incidence of conditions such as diabetes, hypertension, and congestive heart failure in aging adults can lead to chronic edema in the lower extremities. In these cases, improving edema uptake and local fluid flow may overtax the already struggling kidneys and/or heart. Since it is not uncommon for geriatric clients to have swollen feet or ankles, therapists should avoid direct manipulation of the edematous tissue or vigorous reflexive stimulation of the urinary system until kidney and cardiac dysfunctions have been ruled out as causes of edema. In clients already diagnosed with these conditions, administering regular manual therapy sessions before serious edema develops can be a helpful preventive or early management method. Still, therapists treating these clients should avoid heavy soft tissue manipulation and instead focus on gentle stroking, passive movement, and stretching. Time now to consider our first pathology alert, kidney stones. In some circumstances, calcium salts or uric acid found in urine can crystallize in the renal pelvis to form deposits referred to as kidney stones or renal calculi. Small stones may be no larger than a grain of sand and will move through the urinary tract without creating any symptoms. But kidney stones can grow much larger and cause considerable pain as they pass through or lodge in the ureters. This pain is due to smooth muscle spasms stimulated by the irritation of the mucosal lining of the ureters. Although the onset of pain is usually sudden, it comes and goes, and it comes in waves and is frequently accompanied by nausea or vomiting. If a ureter is blocked completely, fluid will back up into the kidney, causing it to swell. This may be experienced as back or abdominal pain and may refer into the groin. Kidney stones are most often caused by dehydration, but may also be caused by parathyroid dysfunction, too much vitamin D, a variety of metabolic dysfunctions, or chronic urinary tract infections. Manual therapy is contraindicated only during an acute attack. Once clients are asymptomatic, all forms of manual therapy are appropriate. Our second pathology alert, we will consider the urinary tract infection, or also referred to as the UTI. The urinary tract is a sterile environment protected by both the slightly acidic pH of urine and the mucus-producing inner lining. While this environment is generally devoid of microorganisms, bacteria can be introduced through the urethra and are the most common cause of infections. UTI is the term used to describe an infection in one or more of the structures that make up the urinary system. These infections generally affect the lower urinary tract, but since the mucosal lining of the urinary tract is continuous, they can spread up the ureters and even into the kidneys, resulting in a dangerous inflammation called pyelonephritis. Cystitis is an inflammation of the urinary bladder, while urethritis is an inflammation of the urethra. These conditions can be caused by an infection or can result from some other condition, injury, or disease that impairs urinary function. Common UTI symptoms include frequent urination, pain, or a burning sensation while urinating, and cloudy or blood-tinged urine. Other symptoms include abdominal, pelvic, or low back pain, as well as fever and general fatigue. Women are more susceptible to UTIs because their urethra is shorter and closer to the anus, which is populated with many types of bacteria. The risk of developing a UTI is increased in catheter users, people with diabetes, and in women who use spermicides and/or a diaphragm for birth control. While many forms of manual therapy are systematically contraindicated during an acute infection, zone and meridian therapies are often viewed as safe and indicated. These reflexive techniques are intended to stimulate organ functions without direct manipulation of the inflamed structures. Still, these techniques should be used with caution since clinical experience suggests that even indirect stimulation of the urinary tract may exacerbate or spread an infection. Okay, so we have reached the end of today's lecture, and for assignment number 15, we're going to be using the Thinking Beyond format to complete this assignment. How does hydration impact each system in the body? What do the respiratory, gastrointestinal, and urinary tracts all have in common? How do they differ? And what would be the consequences of using too much pressure on the kidneys when applying manual therapy? What could be damaged, and how could that impact the rest of the body? And as always, this assignment is due by 11:55 p.m. this coming Sunday. If you have any difficulty with this assignment, you may send me an email or shoot me a text message. My office hours are on Thursdays from 4 to 6 p.m. And with that, I look forward to receiving your assignments, and I will see you in the next lecture.